It's that time of year again. The holiday season is upon us, as well as a lot of different emergency visits. Now we're going to be highlighting some of the most common holiday emergencies today, looking at falling objects. Now, we all know that a lot of our neighbors and even some of our family members are putting up decorations, trees, tinsel, lights around the house, getting on ladders and things, and there is a tendency for items to fall, and if you have items that fall, they can cause some severe damage. Specifically and most importantly, they can cause head trauma. So if you do have decorations falling on your head from the roof or upsetting a spouse that hit you with a rolling pin, you could suffer from some severe head trauma. And we're just going to outline very quickly the three main types of trauma that can occur within your brain. So first, we have extradural hemorrhage, and this would be most likely associated with a falling object, such as seen here in our little cartoon diagram. So this is associated with blunt force trauma, and it can lead to concussion and coma because of compression. Now, as you can see here, it is an extradural hemorrhage because the blood is accumulating on the outside of the dura mater, which here is depicted in blue. And normally this occurs from something like a middle meningeal artery break, where blood is accumulating and creates a pressure on the brain. And as you can see on the ventricles, they have been deviated to the right laterally, and they are no longer symmetrically in the center. So this deviation from the center, as well as the increased cranial pressure, are what can create the concussion and coma. And this pressure needs to be relieved and the fluid needs to be drained. You could also have a subdural hematoma, which is an accumulation of blood within or underneath the dural layer. So you've got blood that is actually creeping up on the brain. And this is associated with blows to the head, which causes the head to jerk back. And this jerking motion can actually tear between the two dural matter layers, because there's two layers of dura mater, and when they are split and the blood accumulates in between splitting these layers is when you'll have a subdural hematoma. And this is typically a tear in the veins which causes this type of subdural accumulation. Now, we can also have a subarachnoid hemorrhage. Now, this is a rupture of an artery and is typically associated with a stroke, where there is a weakening of the artery in question, and it could either be due to plaque buildup or increased pressure, or there's just a weakening of the wall innately. So this would also be associated with cranial fractures, where there are fragments of bone that could actually pierce into an artery and could rupture it, causing a buildup of blood, and this is typically associated within the brain. Now, how can you tell the difference between these three clinically? The extradural hemorrhage typically looks like a lens shape. It has very defined borders and one bubble. The subdural hematoma is typically seen in a longer stretch or a bumpy stretch like I've depicted here, and it creeps up on the sulci and gyri of the brain, whereas here normally has a very distinct border, which is the dura mater. And then the subarachnoid hemorrhage normally is seen somewhere within the brain, as opposed to creeping up on one of its borders. So be careful this holiday season and avoid allowing objects to fall on your head.